Hello, welcome to Dr. Kelvin Nguyen channel. Today, the topic that a lot of people actually ask me, a lot of my patients ask me, especially after a colonoscopy, is hemorrhoids. As you know, when I do a colonoscopy, the most two common diagnosis that I would make after a colonoscopy, one is hemorrhoids and the other one is diverticulosis. So I will talk about diverticulosis in the next topic, but for today, let's focus on hemorrhoids. So hemorrhoids you can categorize into two different groups. One is internal hemorrhoid and the other one is external hemorrhoid. They're actually very different. So let's just overall, what is hemorrhoid, right? So hemorrhoid is basically, you can think about it as bundle of blood vessels, usually veins, in the rectal area. And so in order to tell if it's external or internal, there is a difference. So there is a line we call the dentate line. What is the dentate line? The dentate line is basically, you can think it's the border to differentiate between rectum and anus. Anything on the outside part of the dentate line, we call it external hemorrhoid. And anything beyond the dentate line but within the rectum, we call it internal hemorrhoid. So let's talk about external hemorrhoid real quick. And for the most part, that's where most people actually feel a little bumpy, lumpy down there. Symptoms from external hemorrhoids could be you will feel a lump, you will feel something there. Sometimes it can get worse when, say you do some heavy activities or when you're constipated, for example. That can get worse. And the most common scenario is with external hemorrhoids, you could feel pain. So when someone say you have external hemorrhoids, the most common symptom that I have to think of, or I have to make sure that a patient is aware of, is having rectal pain or anal pain, and it's really usually it's excruciating, and with a known history of something lumpy out there. Why is that important? When there is pain that is associated with external hemorrhoid, what it means is that there is potential blood clot inside the external hemorrhoid. And normally, it's so painful that some patients just thought they have to go to the ER. Usually the treatment, normally, you actually can wait it out until it actually improves, meaning your body actually has the ability to resolve the blood clot itself. And if it is so bad, and you end up in the ER fast enough, usually within the first 48 to 72 hours, then, and it is so symptomatic, meaning so painful, we actually can make a little cut and remove the blood clot for you to help improve the symptoms. But otherwise, beyond 72 hours, usually we say, it will take time and it will resolve eventually. So that's for external hemorrhoid. Now, and the way we can tell is basically doing a rectal exam, and you could see that. Now for internal hemorrhoids, you actually, for the most part, you don't see it. We break it down into 4 different gradings. So from 1 to 4. One is grade 4, meaning it's always there and you cannot push it back, and that makes the difference. So, but for the most part, most of internal hemorrhoids, people don't see it. And during the colonoscopy, when I'm about to finish the colonoscopy, I usually turn the scope around within the rectum. That's when I actually can check for internal hemorrhoids. And once we find out if someone has internal hemorrhoid, the symptoms that usually people experience, usually we call it painless bleeding, meaning you have rectal bleeding and it's not painful. And that's very common. If anything, it's that probably the most common scenario when someone actually coming in for a colonoscopy for rectal bleeding. And because it's so common, so I usually try to calm patients after a colonoscopy. If I'm gonna tell someone that, oh, we find internal hemorrhoids, but don't get worried, 9 out of 10 colonoscopy that I do, especially as you get older, your chance of having internal hemorrhoid is getting higher, right? If you think about it, it's kind of a wear and tear situation. Over time, you have these bundles of vessels, in your rectum, and by gravity, everything is being pulled down. And if you are heavy, bodybuilders, you work out, you do a lot of activities that increase intra-abdominal pressure, meaning the pressure inside your abdomen, you keep holding the pressure there, when you work out. Or if for females, if you deliver or have babies, that 9 months that you're carrying a baby, that's putting a lot of pressure into the pelvic floor area. And so all those are kind of risk factors to develop internal hemorrhoids. But for the most part, okay, you have internal hemorrhoid, you leave it alone, you don't touch it, you leave it, it's not bothersome, then we leave it alone. Now, if it's bleeding and it kind of comes and goes, so the key thing here is make sure you're not constipated. The constipated would definitely make it worse because you straining and that putting a lot of pressure down into the pelvic floor area. And when you're pushing, you have the tendency of pushing things out. That would exacerbate the internal hemorrhoids. Now, if hard stool getting by, right, then that's when you irritate the hemorrhoids and it start bleeding. The other things actually a lot of people do nowadays is, spending so much time sitting on a toilet bowl. Normally I would say try to go in and out within 3 minutes if you can. So I kind of give a little slack. I say 3 to 5 minutes. Don't bring, a newspaper, don't bring your cell phone, don't bring your laptop into the toilet, because that's when you forget that, you in there doing the job, and you don't want to just sit there and doing a second job, which is reading or playing video games, or even watching a movie on your laptop while you're in the toilet. So and so if it happens that the bleeding happens quite often, then there are a few tricks that you can do. You can apply some topical. It's usually a topical steroid. I usually say apply it, once or twice a day, no longer than 2 weeks, because since steroid has a tendency of, thinning the mucosa around there, and eventually you can bleed not from the hemorrhoid itself, but from the mucosa being thinned out. And then if it get worse, then you can do what we call sitz bath, which is sitting in the warm bath for about 15 minutes. Do it like 3 times a day. That usually calm down the hemorrhoids. Again, the key thing is make sure you're not constipated. If you're not eating enough fiber, then I would recommend to take more fiber. If you're not drinking enough water, then you should drink more water. There is no real cutoff in terms of how much water one person needs. And over time, depending on the season that you're in, the amount of water you need will be different as well. So, the general rule, we usually say 64 ounces. That might change from person to person. But make sure that you hydrate it. And that's very important. And the last resort is to do what we call hemorrhoidectomy, which is we do the banding, or by putting on a rubber band around the hemorrhoids, and hopefully within a week or 2 it will drop off and you can kill off the hemorrhoids that way. Keep in mind, with hemorrhoidectomy, even if you do it, eventually they potentially can come back if you don't take care of the underlying issue, which is the whole constipation, doing straining activities, that sort of thing. Imagine these are blood vessels. You need blood vessels in the rectal area, so you cannot really get rid of them completely. So so keep that in mind. So it's very important. And I usually calm the patient and say, you don't need surgery. Everyone would ask, do I need to get rid of the hemorrhoids? Doctor, why didn't you remove the hemorrhoids from me? Keep in mind, 99.9% of the patients with hemorrhoids, you actually don't have internal hemorrhoids. You actually don't have to do anything. So that's a little synopsis of hemorrhoids and what are the symptoms and how to take care of it. I hope that you get to realize these are common things. It's kind of like we don't talk much about it, right? It's kind of like every time when I talk to patients during a colonoscopy, you could tell that people are just lowering their voice and kind of mumbling in a way, and it's kind of a taboo even talking about it, even in the setting of having a colonoscopy. So so I understand that, but I think for me it's just so common. So I try to make people feel comfortable discussing about it and talking about it, and realizing that these are normal findings, and don't get worried. And so I hope that I relay that sensation to you and you understand better about it. See you next time. All right, you guys have been watching my YouTube channel of Dr. Kelvin Nguyen. If you really love what you're seeing, please subscribe to my channel. You can do it for me, or you can do it for the duck in the background. They will love it too. See you next time.